Are you curious about detox or detoxification but are worried about safety? Have you seen people online, on video apps, etc., warning you, maybe physicians, maybe other healthcare providers, saying detoxification might be dangerous for you? Why would that even happen, and how can you make sure that you're going to do it safely? Welcome to my YouTube channel. I'm Dr. A, and I talk about integrative medicine, holistic medicine, and all the related topics to that. And normally we talk about treatment of complex chronic diseases, oncology, and a number of other things. Well, today's topic, though, is going to be why would a doctor or other healthcare provider warn you about detoxification? So there's a few areas where most of the concern comes from. And as a physician myself, I can understand where these things come from. But on the other side of the equation, there are many ways to do detoxification so that you stay safe, you know what's happening in your body, and also you can connect with healthcare providers who can help you along the way as needed. So the first area that is a problem in many cases is not knowing what it is that your body is trying to get rid of. So if you think of the idea that many things that are toxins or toxicants in the world that are not good for us have a way obviously into the body, but they also have a way at least partially or fully to get out of the body because the body has detoxification processes. If we understand that we live in a world that has a lot of toxic exposure, we can also understand that we can do things to help to relieve some of that toxic burden. But in most cases, unless you're doing just very general, what we would call depuration, where you're just helping your body kind of move whatever is there around, it's really good to know the level of toxicity that you have, what's there, and if you're doing stronger and stronger sort of interventions for detoxification, just something like chelation or other chemical detox, etc., you probably need to know what's there in the beginning, at least a snapshot of your body burden. Now, to be fair, there's no way and there's no test to tell how much of any toxin is fully in your body, but testing for chemical and biotoxins and metal toxins can give you a starting place, which is very, very important to do. So testing an improper workup, I think, are one of the reasons that some of the doctors on the video apps might be concerned about people detoxifying or doing depuration and not really knowing what they're starting with. The next thing is, if you're doing this on your own, a doctor might be concerned that you're not having anyone monitor you as these nasty things move through your body and come out. And this again comes in levels. So if you're doing natural things that we would call sort of natural depuration sort of just helping your body to remove things through its normal processes, this may be very safe because you might just be increasing the amount of movement that you do in your body. You may be drinking more water. You may be taking some additional basic supplements along with your diet, things like that. The problem that comes, and this is something that I've certainly seen, and I've got other videos on unfortunate stories I've seen with detox, is if you start to detoxify things and you don't know that they're maybe moving around in your body, or maybe they're getting caught in one part of your detoxification system in your body, you might not know which of the symptoms that you're experiencing are due to the fact that you're trying to get junk out of your body. It gets caught partway through, and then body experiences symptoms from that. So again, having somebody that you can have help you monitor the process and bounce changes in your symptoms, etc., someone who's a healthcare practitioner, is very, very useful. The other thing that can happen, and I've actually seen this happen in a few cases, is a potentially dangerous either combinations or interactions between prescription and over-the-counter substances that you might be using. And sometimes when you're doing detoxifying, etc., you may add some new things in. And if they're not timed appropriately with, say, a prescription you're taking or something, they might make the prescription not work as well. So it's not that you can't have things that help with detoxification to add in, say, as supplements or other things beyond just, moving your body and hydrating and heating your body up, etc. But sometimes you have to be careful if they're maybe taken at the same time or they're taken in different doses. is that the new things you're taking might interfere with your prescription medications or even some of your over-the-counter medications. So there are ways to avoid those sort of interference, but again, that sort of takes a top-down view by a healthcare provider to help you out with that. So ending on a positive note, what's the best way for us to stay safe? The first thing is to have a plan and work with some type of healthcare practitioner who is aware of and understands the depuration and detoxification process. Now, this could be any number of healthcare providers. There are many who are very good at this. There are many where this is a specialty area of theirs, and normally you can look around and find people in usually the integrative community to help you with that. But that's one huge area of safety. The next thing is a lot of the depuration and detoxification you are really in charge of yourself. It's your body. You're going to do a lot of these things. So that might be maybe with some guidance. You're going to also do some sauna therapies, or you're going to start to do more movement of your body, or you're going to increase your hydration, or any number of other things. Well, again, you are going to do as much as you can yourself, but it's good to check in periodically with your guide, with your healthcare provider, just so that they know that you're maybe having to pause therapy, or you're ratcheting up therapy, or you're having some sort of other thing. You need feedback with that person. It's just another set of eyes on what you're really doing for yourself, but it can help keep you out of trouble. Or if you find new symptoms are popping up, sometimes that's a good sign, but it means you need more support to help these nasty things get out of your system. The other thing is, don't go too fast. It's a very appealing kind of microwave healthcare ourselves, and we get really worried that we have a lot of toxicity, which all humans do nowadays, and we want to speed up getting rid of things. So we may go into therapies too quickly. We might go from no exercise and body movement to too much and then hurt ourselves or something. Or we might go from no heat therapies to doing a whole bunch of sauna and kind of getting sick without sort of working our way into it. Or we might start to take any number of additional dietary supplements that might be there to help, but we might go too fast into those. So it's always okay to go slowly and see where your tolerance is, and then add on. And again, another set of eyes on things can really help you with this. Final tip I would give for safe detoxification, depuration, would be attend to the basics. So things like hydration. By hydration, we increase the amount of fluid, water moving through our body. That helps our body to actually literally move good things into the cell and bad things out of the cell. A lot of that is based on how hydrated we are. We want to have regular, obviously, urination to get rid of things, but also regular bowel movements. Some of the people who I've seen get the sickest during detoxification and depuration have been people who are going along, everything's going fine, and then they get constipated. And what will happen is some things can actually reabsorb from the digestive tract back into the blood. You do all this work to get the toxins out into, say, the stool to leave your body, and if the stool's in there too long, it will reabsorb, and the person can actually get sicker. So regular urinating, regular bowel movements, moving your body, because that's one of the best ways to not only move body through the large muscle mass that we have, but also move the blood through your major organs, your spleen, your liver, your kidneys, etc. The more we move the body, the more the blood moves, and the more the blood can be run through these quote-unquote filtering apparatus in the body. Diet is very important. We have other videos that get deeper into diet, but it turns out, just for a really quick snapshot into diet, of course we don't want to be having a diet that is full of new toxins, so pesticides and herbicides and fake colorings and all that stuff. The more that you can reduce, naturally you're going to be less toxic, so that's good. We talked about hydrating, that's part of your diet, but then also there's a lot of foods that are natural binders, natural fibers, that have both a prebiotic benefit, helping your microbiome, but also have a binding ability, so that when your gallbladder sends the bile out, which has a lot of toxins in it, sometimes the fiber that's in your food can actually hold on to that and help take it out of the body. So diet's a very big part of this. And then sometimes, as I say, you might kick it up a notch and do some things that are extra supportive, such as nutritional supplements, etc. And again, if you're going to do a lot of that, I really would recommend that you work with some sort of healthcare practitioner who is trained in those areas and can give you guidance. Because what we see as people detox is they may start at one place and need one set of things, and then as their body starts to get get rid of things, then they move on to needing different sets of things as well. And again, it's good to have that extra set of eyes on you and the case as you go through. I'm Dr. A. If you like this video, you might like one of these others that we post up here, and we always try and have some other links for you to listen to. You can also go to the main YouTube channel and check out our playlists. See you later.